Hello, everyone. My name is Maya Jain.
And I'm Matt Bolis.
We're undergraduate researchers at McMaster University, and today we'll be discussing our needs assessment survey of patients attending McMaster's Fracture Clinic, which aims to understand the experiences of marginalized patients and focuses particularly on Indigenous populations. Okay, so in Canada, Indigenous peoples make up approximately 5% of the total populations, with 2.9% of all those residing in Ontario identifying as Indigenous, so First Nations, Métis, or Inuit. Indigenous populations in Canada unfortunately face various interconnected challenges that can lead to adverse health outcomes. These include the enduring effects of colonization, the impacts and the aftermath of the residential school system, and obstacles in accessing specialized healthcare compounded by limited economic and cultural support. Additionally, many Indigenous people may be reluctant to seek out necessary healthcare out of fear of experiencing anti-Indigenous discrimination. These anti-Indigenous beliefs and practices, often propagated by healthcare environments, can further decrease the quality of care received by Indigenous patients. We would like to acknowledge Brian Sinclair, an Indigenous man who passed away while waiting for care in a Winnipeg emergency room in 2008. While he came in to receive care for a treatable bladder infection, he was discovered dead after 34 hours. An inquest reveals that this was the result of anti-Indigenous racism and assumptions made by medical staff leading to his fatal neglect. Several additional cases, as seen in the deaths of Joyce Echaquan and Heather Winterstein from St. Catharines, Ontario, motivate us to actively work towards dismantling systemic racism within healthcare settings and to ensure a culture of equity and respect for all patients, particularly Indigenous individuals. So our study objectives revolve around firstly identifying the presence of anti-Indigenous racism or discrimination in orthopedic care. Not only do we aim to understand experiences as described by Indigenous patients and their families, but also the reasons and obstacles that may explain why these instances have not been prevented so far. Our second objective is to identify common barriers in the orthopedic setting for Indigenous patients and marginalized communities. So these include accessibility challenges in reaching the clinic, particularly geographical barriers, desired cultural resources for Indigenous patients, and Indigenous health concerns, including the mistrust in healthcare services. So our study will possibly reveal insight into how we can improve trust within patient-physician relationships. Our study is comprised of an exploratory quantitative survey with multiple choice and Likert scale questions. There are also written comments which provide respondents the opportunity to voice their opinions and concerns. Our survey distribution has taken place from September 2023 to February 2024 at the McMaster Pediatric Fracture Clinic each Thursday. Essentially, patients and families are first informed of the study from a circle of care member, a receptionist, resident, or clinic staff. Afterwards, they are approached by a student volunteer to complete the survey in private. These volunteers and every member involved in the study underwent culturally competent research training surrounding the history of anti-Indigenous racism and discrimination in healthcare in order to properly facilitate the study. The survey was designed so that there was no pre-screening prior to completion. Additionally, each participant had the ability to self-identify in any category or section of the survey as Indigenous. This ensures that information is collected in ways that are safe and respectful and do not cause harm based on Canadian guidance on the use of standards of race-based and Indigenous identity. The survey is offered and intended for anyone supporting a pediatric patient at the fracture clinic, but our Indigenous care-focused survey remains at the end of the survey package and is intended only for those who identify as Indigenous. Throughout this process, we have prioritized Indigenous community involvement. We continuously update the Indigenous Health Network and Indigenous Health Learning Lodge for data analysis and sharing to maintain Indigenous data sovereignty. And we have thoroughly involved them during our ethics board clearance for feedback and changes. Overall, we are guided by OCAP principles, meaning that we prioritize the ownership, control, access, and possession of Indigenous data by Indigenous communities. We've collected over 400 surveys so far and done some preliminary analysis, which Matt will now describe.
Sorry about that, guys. Okay, so now we're just going to be taking a look at the results of our survey responses. So these results were tabulated from participants who self-identified as Indigenous. So we first asked patients what option best describes where they live. So as you can see, the majority of Indigenous participants reported Okay, so as you can see, the majority of Indigenous participants reported living within urban centers, accounting for 56%, followed by rural and remote communities, comprising of 28%, and First Nations reservations comprising of 12%. And additionally, 32% of patients reported living 50 to 110 kilometers from the clinic. So such distances can require multiple hours of travel to attain specialist care. So in our questionnaire, we first inquired about accessibility challenges in accessing the fracture clinic, and options on the survey range from communication barriers, previous healthcare experiences, safety risks, and/or scheduling changes. And the top 3 challenges reported were long wait times to see a healthcare provider, scheduling, and the cost of travel, which can be explained given that the significant percentage of participants traveled over 50 kilometers to reach the clinic. So when we asked patients about the factors that can affect their trust in healthcare services, we found that the top 3 factors were feeling like our family and our healthcare provider makes goals and decisions together, how honest the healthcare provider is with us, and the skills of our healthcare provider. So as you can see, each of these responses are part of a patient-centered care approach, which stresses collaboration in the first response, dignity and respect in the second, and information sharing in the third response. So while this survey aims to understand the experiences of anti-Indigenous racism and discrimination, it also aims to take this one step further by understanding factors or reasons why anti-Indigenous racism has not been prevented in the past. So when asking patients what factors they believe influence anti-Indigenous racism, the top 3 factors reported were staff not being regularly reminded about the ways discriminatory behavior can occur. The second reported factor is that Indigenous personnel are underrepresented at all levels of the organization, and it was actually recently reported by the Canadian Medical Association that only 1% of physicians identify as Indigenous. And the last factor reported was that there was an absence of training or inadequate preparation by professional colleges on cultural safety training or sensitivity. So this just stresses the importance of continually educating the care team through sessions including rounds and seminars, and additionally, these results allow us to consider the importance of educating the next generation of healthcare providers. And Dr. Farrugia, who is here today, plays an important role in this as the chair of Indigenous Health of the Undergraduate Medical Education Program at McMaster and the Pre-Clerkship Integration Foundation Director. So what is so unique about this survey is that it takes all the factors previously discussed, including trust, discrimination, and challenges, and aims to understand how this can affect the patient care experience. So one of the questions we asked patients was to rate on a Likert scale how much they agreed with the statement, "I feel that my healthcare providers have a good understanding of Indigenous health issues and concerns." So in observing the results, we found that most patients were neutral or agreed with this statement. And another question we then asked patients was to rate on a Likert scale their agreement with, "I feel comfortable discussing my cultural needs and preferences with healthcare providers." And most responses were in agreement with this statement, which helps inform us that the members of the Circle of Care team are doing their best to ensure patients can disclose such information with them. So in asking patients the top desired cultural resources they would like to see to enhance their healthcare experience, the top 4 answers in order of priority were traditional healers, culturally based spaces for ceremonial practice, Indigenous patient navigators, and cultural advisors. And currently at McMaster Children's Hospital, there are smudging spaces, Indigenous patient navigators, and Michaela's room, as you can see here, which is a quiet place to retreat, reflect, and learn and participate in Indigenous culture. And while many hospitals in late 2023 have started to incorporate Indigenous patient navigators, the Women's College Hospital in Toronto is actually the only hospital in the GTA region that has integrated Indigenous healing and wellness into its electronic medical record system. So this means now that doctors and nurses can refer First Nations, Inuit, and Métis patients to a traditional healer as easy as any other healthcare practitioner when planning follow-up care. So now where do we go from here? And how can we keep accountable to using these findings? So in seeing what patients would prioritize to provide quality health care for Indigenous people going forward, the top 3 priorities were improving hospital policy through ensuring that all organizational policies and procedures are examined using an anti-racism, cultural safety, and health equity lens. And the second being prioritizing an action-oriented response by ensuring that healthcare leadership strongly addresses racial prejudice and promotes Indigenous cultural safety. and the last being the training of all staff through cultural safety training being mandated as the minimum standard for all employees within a healthcare organization. So, in observing the strengths of this study, this is actually the first study of its kind in Canada where patients' voices are being amplified to understand the instances of anti-Indigenous racism. It is also one of the first studies that aims to understand the experience of Indigenous patients in a fracture clinic setting. And secondly, our top priority throughout this study is to maintain confidentiality, privacy, and respect. And this is why a strength of this study is that it prioritizes cultural awareness. And this was crucial in the development of our survey and our choice to offer all sections of the survey to all participants. And another strength is that this is an Indigenous-led study by Dr. Farrugia as the lead PI and incorporates Indigenous research methodologies. So in observing the limitations of this study, it is a single-centered study conducted solely at McMaster Children's Hospital, so this may limit responses to this site. And this survey is unique to patients in Southern Ontario, and this may cause the generalizability of the results to be limited. And secondly, this is a new field of evidence, so there are no previous comparable studies, and this is allowing us to assess challenges for potential improvements. So our hope for this study is that with the results, we can identify strategies for improving Indigenous health services at the McMaster Pediatric Clinic. And we also aim to discuss these strategies with hospital and community stakeholders through an integrated knowledge translation approach. And our hope is that our project will be able to shed light on the limitations in providing accessible and culturally safe care for Indigenous patients. And lastly, by increasing the amount of literature available on Indigenous patient experiences in an orthopedic setting, we strive to bring more equitable care to a population that has traditionally been and still is experiencing the impacts of colonization through anti-Indigenous racism. And thank you so much for listening to our presentation. We would also just like to take this time to thank Dr. Farrugia, who is here today. Dr. Farrugia is an orthopedic surgeon who has generously included us on this study, and we are so thankful for the time she has taken to walk us through conducting a study of this type, and all study team members involved have gained invaluable insights into Indigenous history in Canada and research methodologies in this field. Thank you. Yeah, that's a great question. So in developing our survey, we did basically do a literature review and looked at other surveys that looked at similar problems within the realm of healthcare. So for example, for the Likert scale questions, we did consult an independent investigation into Indigenous-specific discrimination in BC healthcare. So a survey of that type with a Likert scale was administered, but the only difference is that this was conducted with BC healthcare professionals and not patients.
Just to add to that, after doing a literature review and collecting kind of questions that we wanted, Dr. Farrugia, her guidance allowed us to alter the questions to specifically fit kind of our research center, so the pediatric fracture clinic, and also just a more inclusive approach to make sure the wording and everything was easy and accessible.
Great. And did you administer the questions in the survey?
So essentially, we hired a group of volunteers, and we went through the cultural appropriate research training to really ensure that when they were in the fracture clinic with the circle of care member firstly informing the patient and their family of the study, then the volunteer would approach the patient. So we were kind of the facilitators of the volunteers, so we weren't necessarily, we were there in the beginning stages to make sure the volunteers knew what they were doing, but after that they were essentially pros. So.
We have time for one more question. Boytech?
Very quick, related question. Did the volunteers assist in the participants filling out the survey, or was it self-administered?
It was a self-administered approach,
They just
and
approached.
yeah. So and we wanted to make sure to ensure privacy because some of the questions could potentially be triggering. So we made sure that once the volunteer gave them the survey, they also informed them of the consent form, which was really important. And then they would administer the survey, and the patient and their family were able to complete it on their own.
We actually have time for one more question.
If you go to your slide where you were presenting the results.
Yes.
There.
Yes.
I think when I saw the first slide, I first thought, oh, there's a large, most people
Right.
And it is probably the way you look at it.
Mhm.
I feel that being neutral sometimes is a way of not responding.
Yes.
And whether you count neutral with agreement or neutral with disagreement, on a 4-point scale, I probably would put neutral and disagree together. What are your thoughts on that?
Right. That's a great point. And I think it's something important to consider. And as well, like, we saw that, like, although we did administer 400 surveys, we did receive around 25 of those who self-identified as Indigenous. And as you said, if a lot of them indicated that they were neutral with this statement, this could indicate that they might be leaning towards more of a disagreement on this side. And I think this just goes to show how there are still systemic challenges when administering surveys to Indigenous populations. And just due to previous mistrust within research, this might be a limitation whether they were filling out the survey or even chose to self-identify as Indigenous. But thank you for your question. Yeah.
All right, thanks everybody.
Okay.